Hi, Dr. Lin. So, for full thickness wound, we have a specific reconstructive ladder, and this was introduced about 50 years ago. But however, in 2013, there was a new reconstructive ladder which was published, adding on this dermal regeneration template and also negative fragile wound therapy. So, to answer your question, from below we have secondary healing, we have skin grafting, flap surgery, and we have the more advanced dermal regeneration template such as this OTC. For standard, this varies quite widely because it depends on what our intention is, how fast we want the wound to heal, how bad the wound is, how severe the anatomical defect is. Let's say for majority wounds will be covered with a skin graft. This will cause rapid wound healing, yes, but however the long-term outcome of scarring and contracture, that is undesirable side effect. However, OTC, being variation or innovation from the standard bovine collagen, the most popular one is the Integra. We hope to see what we call a dermal regenerating. That means with the mist, there will be less contracture and less scarring. And hopefully other effects of this scarring will be reduced. For standard protocol, which is, I mentioned just now, skin grafting, which is the most widely used for full thickness and large surface wounds, we only have epithelialization and the dermal component is not regenerated. And therefore, the long-term effect will be the scarring and the contracture formation. And there will be a host of other undesired side effects after. With the OTC, which is the variation of the traditional, what we have now, the more traditional, more published ones, such as Integra, intend to create the dermal component, which will give us the pliability, the suppleness of a normal skin. And this will in turn reduce the scar formation. This is, I think, our first local produce of such endeavour. We hope that it is more easily accessible to more patients of varying socio-economic status. So it is great that it is also produced by UKM, my university. Generally for Malaysia, Southeast Asia, I think this is a very good effort for us. Hopefully the target patients can have more access to better treatment in the long run. This invention, since the current biomaterial which we do have, the cost is quite high. And we would hopefully, in this development, we will have a more affordable modality for all our patients. And it is easy, hopefully it's more easy access. And this will reduce a lot in terms of cost of tissue, of hospital stay, and then a period of staying, faster wound healing. With more accessibility of such a product to the patient, we now can reduce our reliance on previous procedures which require more extensive surgery and more extensive costs and more extensive time, higher level of expertise. There is also this concept of tissue cost, because let's say we want to cover a wound, we might need to take a donor from the patient. For example, a tissue from the contralateral thigh or from the thigh or from any part of the body to be transferred to the area, and however the donor site might have some morbidity also, some side effect too. So this will reduce what I would call a tissue cost to the patient too. My acquaintance with Cyto is quite short for now. But so far, from what I've seen, they have the positive attitude and motivation. So far, it's all positive vibes. So hopefully, I'm looking forward to working together more.